Hey, my name is Simone Somek, and as you probably know from my other videos, I am a person with a complex regional pain syndrome, CRPS, and I like to make videos to talk about the treatments and therapies that I've tried, to talk about what has worked for me and what has not worked for me in managing the pain that comes with this very challenging disease. So as you can see from the title of the video today, we're talking about a very controversial and popular topic, which is ketamine. I'm going to talk specifically about ketamine from the point of view of CRPS and chronic pain and nerve pain. So we're not going to be talking about ketamine for depression or for PTSD or other types of pain. Before I get started, I want to stress that I'm not a medical professional. I'm not an expert. This video is not intended to be professional or medical advice. And also it's not meant for entertainment purposes, but it's specifically created to help people who have CRPS and who are trying to figure out what their next steps are. So my journey with CRPS has been a lot about trial and error, and I think a lot of people will kind of relate to this. You try different things to see what works for you and what doesn't, what helps and what doesn't, and you probably will end up with a series of tools, hopefully, that together will create a good toolbox for you to survive. The three main concerns that people have when it comes to ketamine are, number one, the financial aspect, the cost of this substance, this drug. Number two is the fear that people have about trying something like this. And number three is finding a medical provider or medical facility where you can access this drug. Cost is a huge hurdle, a huge obstacle for a lot of patients. And when I started looking around, I live in Manhattan, I started looking around, okay, where can I find this? First of all, my own hospital, where I had surgery several times and where I had been treated and where I had several of my doctors, they do it, but at an insane cost. We're talking about a full cycle of, I think, 3 to 4 infusions or something like that. It was quoted to me for $7,000 total, and I thought that was insane. I understand that they just reserve a room for you. You have a private nurse that administers the drug, and you have you really have top level medical experts following you through the process, but I was not able to afford that, nor I wanted to spend that kind of money for this. So I decided to look elsewhere. There are different forms that you're going to find ketamine in, and number one is the IV. Number two is nasal spray, and number three is a troche that you put under. You just let it sit under your tongue. So let's dive right in and let's talk about the experience with the IVs. I ended up finding a center here in Manhattan where I was visited by a doctor. I showed them my medical records. They saw what my history was. They saw what I had already tried. They understood, they recognized, they acknowledged that it was a good idea for me, good next step for me to try this type of therapy, and it was still extremely expensive. We're talking about a lot of money still, but it was more affordable. And at that time in my life, I was working a job that allowed me to do this, and I was just like, let's just try. I don't want to live with this disease and the pain that comes with this disease without having tried it. They usually gradually go up in dose, and they want you to do multiple sittings, multiple infusions, because with each infusion, given how you reacted to the previous one, they're able to choose how much to increase the dosage and kind of like what to do next. I was able to only do 3 infusions, one after the other, because of the cost. I just decided that was kind of my budget, and so it was very much of a financial decision more than a medical decision, which is indeed a little sad. But if I had not had that financial constraint, I probably would have done probably 5 infusions. The reason why they want you to do multiple infusions one after the other is also that they just build up, and the benefit that you might get from one infusion is, let's say one infusion gives you a pain relief that lasts, let's say 3 days, which is already great, but it's not enough, obviously. So you do a second infusion, and the pain relief is extended kind of exponentially, ideally. So by the time that you do 3 infusions, in theory, if the dosage is high enough, you should be getting even a few weeks of relief. My doctor at my hospital, where I was not able to do this treatment because of the cost, told me that some patients experience relief for up to 3 months after a cycle of infusions. So that was very promising, and I went in really determined, and I personally didn't allow the fear of trying this therapy to kind of hinder my desire to try it. So I knew going in that it came with a certain amount of risk, or just it was just could be potentially a very frightening and overwhelming experience, but my pain was so extreme that I was like, I didn't care. So a ketamine infusion comes with a lot of side effects, and the main thing is that it's a very extreme, over-the-top, very overwhelming experience for most people. You might experience hallucinations, you might experience flashbacks from your past, from your childhood, so it's a very trippy experience, I'm not gonna hide it. And also, on top of that, you're gonna experience most probably a lot of nausea and some anxiety. For the nausea, they give you an anti-nausea medication alongside with the ketamine, and oftentimes, especially for pain relief, you're able to ask the provider to give you also a sedative that can help you stay calm, even sleep through the infusion. So if you do that and you take a higher dose of a sedative, you might not even experience any of these trippy hallucinations that I just mentioned. However, for my first infusion, I wanted to be very aware of what was going on, and I wanted to be aware of the experience of, ideally, at least during the infusion, not having pain. So I did not take any sedative that first time. So it was indeed a very overwhelming experience, and I'm not gonna go into the details, but I would say that I was very shaken afterwards. However, the following times that I did it, I ended up taking sedative alongside with the drug, and that definitely helped. I was just kind of like in a state of in a more comfortable state, and I was able to just rest throughout the infusion. One of the main effects that you're looking for, at least during the experience, is dissociation. So you're going to dissociate from your body, and that for pain is an extremely interesting concept, because you can really kind of like detach yourself from your physical experience and just truly be in a state in which, yes, your body exists, but it doesn't really belong to you. It's kind of like an alien entity next to you, and if you really focus, you might experience the pain, but without focusing, you're just not gonna have the pain, and that in it for itself is a very valuable experience. I'm gonna say that I did not experience the level of long-term benefit that I wanted to experience, and it didn't last that long. And I think we're talking about, after 3 infusions, we're talking about probably a couple of weeks of relief, and then the pain, when it hits you back, when it comes right back, it really, really is strong, because you're not used to it anymore, and it just like, you're used to a lower level of pain, and all of a sudden it goes back to where it was before, and that is definitely not a fun experience. Having tried the IV also after that cycle, I did a couple more later on. But having experienced that, I definitely was ready to try a spray or a troche, which is something that your doctor can prescribe. It's a micro dose, I would say. It's much, much lower than what you would get in an IV. And also, while in the IV, the drug goes straight into your blood, so you really get the full power of the drug. With a spray or with a troche, your body absorbs only some of it, so you're not really gonna have any of that trippy experience that we just described. It takes about 15 minutes to hit. You're gonna take it in private when you're laying down and you're calm and you know that you're in control and you know that you're just able to rest. The effect might last for just a couple hours, but then there's something that I would call the lingering effect, which is what happens afterwards. After the drug has kind of like done its course and most of it is out of your system, you might still feel some level of relief from the pain as your brain is still taking time to reset and to go back to that constant pain signal that you receive from your body part that is affected by CRPS. So I don't know, everybody's different. Sometimes the lingering effect might last several hours afterwards, and you might, even if you do it in the evening, you might wake up the next morning still feeling some of that lingering effect. When you have CRPS and you live with this kind of pain, any relief is welcome, and I just welcome it with open arms. I hope this video was helpful. I just really wanted to make it because my previous series of videos about the DRG stimulator was a huge success, and I've had so many people message me over the years, ask me questions, or just tell me, hey, I have my surgery next week. I was just Googling and I found your video and really calm me down, or it really answers some of my questions. So I think that it's so important for us patients to just make this effort to sit in front of camera and tell our stories, because we can really help others. And while my experience is never going to be identical to any of your experiences, it can really, because this is a trial and error experience, that what I've tried, what's worked for me, what hasn't worked for me, could really end up being helpful for someone else. I was very nervous making this video, so please forgive me if I didn't speak as well as I wanted to. I did not have a script, I just had a few notes, and I welcome all of your questions, all of your comments right below, and see you next time. Thank you.